Alright, so today we are getting started now on the parasites and protozoa. Who does not like parasites and protozoa, right? Alright, now I want to explain a couple of things very quickly. There are a lot of different ways we can go about this, explaining these parasites and protozoa. I have chosen to keep it very simple because my purpose in teaching these are more or less to give you the main idea of each of them so that you can make a differential diagnosis and distinguish them from the other parasites and protozoa or bacteria or viruses, fungi, what have you, that you're trying to distinguish them from for your board examinations. Now, yes, I know there are a lot of cool things about these things. Some of these things can come inside your foot, some of them go inside your lung. Oh, look, they make you vomit, and then it comes up out of your stomach and goes into your lung, gets in there, starts to proliferate, goes to your bloodstream. There's all sorts of things these little boogers can do, but my purpose is to keep it very basic and very simple because, for instance, if you are taking a complex, right, out of your bacteriology section or out of your, microbiology section, then you're talking, this is 5% of the, 20% of your test or something of that nature, right? Or, if you're taking USMLE, even less than that. So that's the approach that I'm taking with this, okay? So without further ado, let us go ahead and get started and begin. Let me get a little bit thicker pen here. I think I like this. Yeah, that looks pretty good, doesn't it? Yeah, I think that's what I usually use. $3. JoeyJohnsonDO.com. Go there and donate your $3, people. By all means. Appreciate it. One time only. Thank you. Alright, so the way I've broken this up is what can infect your blood and tissues, what can infect your enteric system, and what can infect your urogenital system for the parasites and the protozoa. Alright, and so as we see right here for the blood and tissue, for Plasmodium, for instance, it can infect your CNS system as well as your blood. For Toxoplasma Gondii, just your CNS, and then for Trypanosoma, your CNS and your blood, and then for Leishmania donovani, it can affect your skin. So what I'm going to begin with is Entamoeba Histolytica right over there, okay? It can cause amoebiasis. Now, there's a lot of different diseases these different boogers can cause as well. I'll let you look that up. I'm just going over very basic points, okay? This one can cause bloody diarrhea, dysentery, liver abscesses with brown-yellow exudate. Remember the difference between exudate versus transudate, all right? And it can cause right upper quadrant pain in the gallbladder area. Microscopically, it looks like a flask-shaped ulcer. If submucosal abscesses, if colon ruptures, it looks like that. Sometimes a ground glass appearance. You get it from cysts in water. Has a trophozoite form or cysts in stool with red blood cells in the cytoplasm, and you're going to treat that booger with metronidazole. Now, Giardia lamblia, okay, causes giardiasis, has a bloating flatulence, a very foul-smelling steatorrhea, okay? So you got fat, nasty, bloating, just foul-smelling diarrhea. Has cysts that are infectious in their form. Once it gets in, then the trophozoites are released in the small intestine. You get this, or who will get this, are mostly campers, bikers, hikers. All right, campers, bikers, hikers. Acquired lactose intolerance can occur in half of the people affected. It's associated with beavers and muskrats, all right, because we're those three people demographic of folks going I talked about. You can have those types of animals there. What you can think about is very fattening Ghirardelli chocolate stuff, okay? So that'll help you think of the fatty steatorrhea and associating that with giardiasis, all right? Ghirardelli or whatever that chocolate brand is so dang good, right? So yeah, that's Giardia lamblia right there. You're going to treat that with metronidazole as well. Cryptosporidium now, parvum, severe diarrhea in AIDS patients. It causes pretty much a mild disease, a very mild watery diarrhea in immunocompetent folk. And you get that from cysts in water. Cysts on acid fast stain is what you'll see microscopically. And you can prevent that via filtered city water. All right. So now let's go over here to the blood and tissue invaders. Here's where the good stuff begins, right? So Plasmodium, it's a cyclic disease, and so you see that there's different forms there: malaria, falciparum, vivax versus ovale. All right, so you have the hepatocytic phase, so it comes into your liver. Then it leads to a burst of merozoites into the blood. Go to CDC, by the way, to look all these up if you're not sure what I'm talking about, and they'll do a much better explanation, I'm sure. So anyway, it goes to the liver, comes out as merozoites in the blood, and infects the red blood cells. And then after it infects the red blood cells, they're going to go on to become gametocytes, and then that'll infect the mosquitoes when they come back and bite your tail to get a blood meal. Then mosquito goes on and delivers them from the gametocyte form. It's going to proliferate and then become the sporozoite form. The mosquito bites another human, sporozoite form goes into them, goes to their liver, becomes merozoites in the liver, starts the hepatic phase again, of course, leads to a burst of merozoites, goes into the blood, infects red blood cells, lets them become gametocytes in there. Mosquito comes and gets a blood meal, goes into the mosquito, turns into a sporozoite goes into another human, goes into the liver, becomes a merozoite, bursts into the blood, etc. Alright, so the differences in these different types is that incubation period of 72 hours for malaria and 48 hours for the other forms there. It's transmitted through the female mosquito bite of the Anopheles mosquito. I'll show you how to spell that after a while. The disease is going to be malaria. It can cause that. Periodic irregular fever patterns and constitutional stuff, as well as hepatosplenomegaly and headache and neurological deficits. Renal failure, anemia, lung edema can come in all of these forms if you get cerebral malaria caused by falciparum. Alright, in fact, the falciparum form is what causes the cerebral malaria, so you have to treat it a little differently because of the CNS involvement sometimes. Alright, you diagnose it with a blood smear. You're going to see a ring-shaped or band-like trophozoites in most forms, or banana-shaped gametozoites for falciparum, so bananas in the brain. Alright, think of that. So you're going to treat Plasmodium with chloroquine or Primaquine for most of them. However, falciparum, remember me telling you have to treat that one differently. So it's going to have resistance, and in that case, you will give falciparum mefloquine. Alright, so Primaquine or chloroquine for the others, but for falciparum, give them mefloquine. Okay, and so yeah, the Primaquine is going to block the dormant form of the vivax and ovale, because the vivax and ovale are the only plasmodiums that can turn into the hypnozoite stage and lie latent in your hepatocytes. Okay, so just to go over that a little bit more, so vivax or ovale, right, they are going to have a hypnozoite form where they will actually lie latent, alright, inside of the liver, and so therefore you are going to then come and give them Primaquine, which is going to block that form. But like I said, if it's falciparum, you're going to have to go to mefloquine to get those bananas out the brain. Alright, so you can remember fearsome falciparum because it has the worst outcome of all of them. It infects all the red blood cells in the brain. Vivacious vivax, alright, because it infects only the young red blood cells and can hide sometimes. It's very vivacious, alright. And then the mature malaria, it infects only the older red blood cells. And I got all that from the Murray microbiology card set. Give a shout out there to Murray and him. Alright, and so you're going to check for G6PD deficiency and thalassemia, because you're going to have some geographic overlap, if you remember, because people with G6PD deficiency or thalassemia are actually going to be somewhat protected against Plasmodium, and you'll find those people in places like Latin America, Asia, and Africa because they have an inherent resistance against Plasmodium. Now, sickle cell patients are protected against fearsome falciparum because their blood cells are just, a little bit too weak to support the parasite. So going on to Toxoplasma Gondii, alright, brain abscesses in people with HIV. You can get encephalitis as well. Also, you can present as pneumonia and myocarditis or mononucleosis. It's one of your torch microbes, don't forget, to cross the placenta. You have the classic triad with this if it's in congenital form. So you have a baby, let's say you're cleaning out cat poop, alright? And so then your baby's going to have chorioretinitis, so inflammation of the retina and the chorion. You're also going to have hydrocephalus in the kid, and intracranial calcifications. Alright, you might get cysts in your brain as well. You can get this sucker from cysts in meat or in cat feces. That's why pregnant women don't clean out the cats. Make a man do it, right? Don't be so independent sometimes. Anyway, crescent shaped with one nucleus and inside of a macrophage is what you'll see here, so it's intracellular. And a drug of choice for this one, tell that pregnant woman to go sit on a sofa and eat a pie. You know she wants one anyway. She's pregnant. You know how they have all those weird cravings. I'm just kidding. My wife would kill me for saying that. But the reason I say go sit on a sofa, because you're going to treat it with sulfadiazine as well as pyrimethamine. I ran out of room. Okay? So go sit on the sofa and eat yourself a pie. Quit cleaning out that litter box, pregnant woman. Alright, so now you're going to look for the serology for this to see the IgM to see if they've been infected. Trypanosomes, all right, all trypanosomes are flagellated trypanomastogoats. Should be easy to remember. They're trypanosomes. It can cause the African sleeping sickness if it's in the forms other than the cruzi, right? You'll see bruci sometimes too. In these other forms down here that are non-cruci, it causes the African sleeping sickness, which will form encephalitis and enlarged lymph nodes along with it. You'll get a recurring fever. You can go into a coma. All right, the sessafly is going to bite you. It's a very painful bite, and I'll show you how to spell that after a while. Also, you diagnose it with a blood smear, and so yeah, it is sure increasing melatonin for you to go to sleep. That's what these suckers do, right? African sleeping sickness, they are sure, because you're going to treat them with Suramin, all right, and you're also going to treat them with Malaria for the CNS penetration. So they are sure to give you melatonin-like effects and make your butt go to sleep. So that's how I remember the treatments for that, right? Now, if we're talking about cruci, the C one, now we're talking about Chagas disease, right? And so we're going to spell it C-H-A, Chagas, all right? Mr. Loverman, Chagas. Okay, so you can get dilated cardiomyopathy with Chagas disease, megalocolon, and esophagus. And so you find this in South America. It's transmitted via the reduvit bug, which is the kissing bug. It'll give you a painless bite, more like a kiss, all right? You diagnose this with blood smear. It has non-flagellated amastogote form right here, okay? Non-flagellated amastogote form as well, and that's going to infect the colon, the heart, and alimentary canal, because it's just like, wee, I don't have to swim and let your bloodstream carry me everywhere. So that's Chagas disease, okay? And so you're going to treat that with nifurtimox, all right? And so the CH and A are big there to help you remember that colon, heart, and alimentary canal, okay? Specifically the esophagus is what it's going to make inflamed there, all right? And so now let's talk about Leishmania donovani. It's intracellular as well. It may infest you, or may manifest after infecting you. It may manifest with spiking fevers and blackening of the skin. Okay, Donovan McNabb was a black quarterback. Donovani, blackening of the skin. Okay, sometimes called black sickness. Excuse me. It can cause hepatosplenomegaly and pancytopenia. It's transmitted through the sand fly. We'll look at that in a minute. And you diagnose that with macrophages with amastogotes in it. Babesia microti, all right, cause babesiosis. All right, you get fever, chills, and hemolytic anemia. It's predominantly in the northeast U.S. Some resources will say asplenia and increased risk of secondary infections will be kind of sequelae of this. It's transmitted through the Zoetis tick. Remember Zoetis? Yeah, Borrelia, right? Borrelia burgdorferi, excuse me. So you got that Lyme burger, right? All right, so this is also going to be there. Give me a little bit of Babesia sauce on my Lyme burger. Anyway, it can co-infect with Lyme disease is the reason I'm saying that. So you diagnose it with a blood smear, and what are you going to see on Babesia? The Babesia cross, right? You're going to see the Maltese cross, which is typically, like if we're in the renal area, you see the Maltese cross, what are you thinking? You're thinking fat, right? And it's a Maltese cross, okay? It's a lipid cast. So right here, it's going to be a ring structure with the Maltese cross in it. That's Babesia right there. All right, and so now Naegleri fowleri, I think is how you say that. This sucker is amazing. So it has a rapid fatal meningoencephalitis that forms. It's transmitted from swimming in freshwater lakes and rivers, and it enters via your cribriform plate. That's right, it goes up through your cribriform plate. Remember, your cranial nerve 1 is going to come out right there. Your olfactory bulbs are going to come out down there, hanging there. It's going to go up through that. Typically 1 or 2 weeks later after swimming in these areas, it's going to be in a vignette. Why? Because it takes 7 to 14 days after swimming in these areas for it to affect you, excuse me, and you diagnose it with the CSF having amoebas in it. The treatment is going to be amphotericin B for some. Some people call it amphoterrible, but this disease is very, very fatal. That's what you need to know. Onset of fever, chills, headache, increased vitals across the board. You compare this with lepto, okay, because with lepto you'll have sudden abrupt onset of symptoms as opposed to this insidious 1 to 2 weeks later. Now tricky over here, Trichomonas Vaginalis. Remember I talked about tricky being green like the Joker's hair or the Riddler. It tricks you, all right? Vaginitis, foul smelling, green discharge, itching and burning. Don't confuse this with the gray Gardnerella vaginitis. vaginalis, which can cause vaginosis. All right, sex is how you transmit this, and trophozoites that are motile on a wet mount is how you'll see it to diagnose it. You give it Metro for the patient and their partner for prophylaxis. Thank you. $3. JoeyJohnsonDO.com. Boom, just under 15 minutes. Bye-bye.